Broadcasting live from Houston, from the space city to the world. You are watching NowMedia Television.
Today in Pain Diaries, did you know that you can heal yourself with your own stem cells? Also, we have a very important guest today. We will be discussing everything about pain medicine, the world of insurance, chiropractic care, and medical technologies that are changing the world. I look forward to introducing my guests. Remember, you can find me, Dr. Suzanne Manzi, at performancepain.com or call 346-217-1111. I'm in Houston, Texas, at Performance Pain and Sports Medicine. Don't forget to watch Pain Diaries on the following channels: Houston, 2110, Beaumont, 2710, Atlanta, 2210, Lake Charles, 2110, College Station, 1410, Eagle Pass, 24, Piedras Negras, 24, and hear us in Chicago on 102.9 FM, 104.3 FM in Huntsville, Texas. Don't forget to tune in to Spotify, Apple Podcast, and Amazon Music. And follow us on all social media and our digital platforms such as NowMedia.com. Please note that the information in this show is for informational purposes only and is not medical advice. It is not a substitute for professional medical advice, and I urge you to seek medical advice from your physician regarding any medical condition. Reliance on the information provided in this show is provided solely at your own risk. Hello, I'm Dr. Suzanne Manzi, and this is Pain Diaries. Welcome back to Pain Diaries. So why do I want to discuss the topic of regenerative medicine on Pain Diaries today? One of my favorite treatments involves stem cells. These little cells are found in our bodies. They're extraordinary. The fact that we can heal ourselves from an injury if given the right recipe and combination of factors, it's remarkable. But as we age, we may need a little bit of help. This is where procedures involving stem cells come into play. Let's start by talking about the goals of regenerative medicine. The goal is to deliver a specialized type of cell to a diseased tissue or organ to ultimately restore that tissue and organ function. But as we age, we have difficulty doing this when talking about our cartilage between our joints, our meniscus in our knees, and all of our tendons. Unfortunately, as we get older, it's harder and harder to get our stem cells to come repair a site that can become injured. The main reason we look to stem cell treatments are for pain relief and for repairing the damaged tissue. We can put the cells directly at the injured site to facilitate healing. How amazing! Unfortunately, controversy occurs sometimes when discussing stem cells here in America, and I'll hopefully help sort this out today. There are two different ways we can do this in the United States. One way is the direct way, where we use stem cells from our bone marrow. The other way is indirectly by using Platelet Rich Plasma, or PRP, that we take and get from our blood. We say this is indirect because the platelet rich plasma signals those stem cells to come to the area and repair the damage. Whereas by using the bone marrow and concentrating it, we put the stem cells directly at the site of the injury. Although the FDA does not regulate the practice of medicine, it does regulate the drugs we utilize. There's a high level of scrutiny on stem cell therapies today, which is why we at Performance Pain and Sports Medicine use only cells that come from the same patient at the same time of harvesting those cells. We don't use cells that come from another person or someone else's umbilical cord cells or amniotic fluid cells. These forms of cells have not undergone the required testing or fulfill the regulations set forth from the FDA. It takes about 10 to 12 years to undergo all the studies required to get FDA approval to become a drug. The FDA also states there has to be minimal manipulation of the cells, which is also why we cannot multiply cells in the United States. You may have heard of companies that replicate and multiply the stem cells, but in order to get them re-injected, you have to pay a hefty price to get this done in a different country, usually somewhere south of the border. What is important, though, is that we do what we can to treat patients with the utmost safety and compliance with the governmental regulations to which we have to adhere. Our patient safety is of utmost importance. Stem cells that we utilize from the bone marrow, aspirate, are taken from the back of the hip or the iliac crest. These cells contain what are called progenitor cells that we use to heal the damaged tissues. These are under FDA regulatory compliance. PRP, which we get from blood, although it doesn't contain any live stem cells, it signals them. This is also under FDA regulatory compliance. Adipose tissue, which is our fat cells, is not currently under FDA guidelines, and amniotic and placental cells are also not under FDA regulatory compliance if they are not containing viable cells. So what is a stem cell? A stem cell is a cell we have in our body that's primitive, and it has the ability to replicate itself, meaning it can differentiate into different tissue types such as bone, muscle, cartilage, or fat. Stem cells are cells that can fight cell death. They also are cells that can reduce inflammation. Adult stem cells are the means by which our bodies naturally heal throughout our lifetime. As we age, it's harder and harder to get the cells to where they need to go. So when we incur an injury, stem cells that were wrapped around our blood vessels are released and migrate to the site of injury. I like to think of them as if they're little firefighters racing to a fire, being called from the firehouse. The stem cells help clear out the area of injury or fire by modulating an immune response, by bringing in antimicrobial agents, and they also signal proteins and growth factors that help repair the area. Thus, inflammation takes over. This is why the body feels pain when we have an injury. These stem cells recruit the necessary cells to come help them to build blood vessels, to help rebuild the tissue that needs to be repaired. This is called proliferation. Collagen is a tissue that is then produced to help form tissue and close the wound or area of injury. Cells that live in the local area then remodel using fibrin and collagen. The stem cells regulate the healing process until the remodeling process is complete. Once complete, they then go back to their resting site on the blood vessels until they're signaled again if an injury occurs. The fire department returns to the firehouse. Then they wait for the next fire alarm. But as we age, our vascular supply to our tendons, cartilage, and discs decreases. So without local blood flow or blood vessels or a highway for the fire truck to drive on, there are fewer stem cells to respond to the injury. This can cause reduced supervision over that healing process. Poor healing causes inflammation, and the inflammation becomes uncontrolled, and the right cells for repair are not brought in to fix the problem. Disrupted communication occurs for healing, and some wounds or injuries can enter a chronic inflammatory state. When we enter this type of state, we face long-term pain, loss of function, osteoarthritis, degenerative disc disease, non-healing wounds, and even ulcers. Without sufficient stem cells, new tissues can become fibrous or tough and scarred and not be appropriately molded to withstand everyday wear and tear. And this is why we have to bring in the stem cells to the area to heal the problem. So I'm Dr. Suzanne Manzi, and that's stem cells for you. We're going to take a commercial break right now, and I'll see you back shortly. Thank you for watching Pain Diaries on NowMedia TV. Hi, welcome back. Dr. Suzanne Manzi here with Pain Diaries, and I am so pleased to introduce my guest, Dr. Billy Choeng. Dr. Billy Choeng, welcome.
Thank you. It's a pleasure to be here with the one and only Dr. Manzi. I'm really excited and looking forward to it.
Awesome. So we're currently at NowMedia TV studios in West Chase in Houston, Texas, where one of your offices is.
Right.
Elite Spine and Health Center. Great, amazing chiropractic office that has two locations here and also in Spring, Texas.
Yes, that is correct.
Tell me a little bit about your office and what you guys do.
Yeah, so we're Elite Spine Health Center. We have a couple locations here in West Chase and Spring, as you said. So I opened the practice back in 2015 with the hopes of, the vision was to try to integrate a little bit both of the chiropractic and the sports rehab together. And so we're just trying to do kind of like a one-stop shop when it comes to chiropractic and rehab. And we provide a variety of different services, from chiropractic adjustments to decompression therapy, dry needling, myofascial release, cupping, you name it, we do most of it. So yeah.
I love that.
Yeah.
I love the fact that us at Performance Pain and Sports Medicine, myself and Dr. Matt Wiederholtz, work together with you
Yes, yeah, for
to
sure.
get patients taken care of.
Yeah, definitely.
We utilize obviously the traditional from our end pain treatments, and from your end the
Yes.
chiropractic type treatments and the myofascial releases,
Yep,
but we also utilize stem cells,
Yep.
which I talked about earlier on the
Yes.
show, where we really want patients to get better.
100%. Yes.
So tell me your thoughts on stem cells.
Yeah, I mean, we love stem cells. I think it goes hand in hand. Obviously, we work together, but we do such different things, but they do go hand in hand. So stem cells, it's our raw material of our bodies that just do amazing things. I mean, it helps, just replicate some damaged tissues in our bodies. It's so good to, not just for orthopedic conditions, but, there are other things that it can do in terms of diseases and neurological conditions. I wish it was more prevalent to the public, but you just interviewed someone from insurance, but it's not recognized as much with the insurance companies, but maybe one day it will be. But it's a great avenue for a lot of patients, for sure. Yeah.
Absolutely. We love working with your patients and getting people better with healing technologies.
Right.
And although it's not covered under insurance, at least we have an option for patients.
Yes,
And
yes, definitely.
our job, as a pain doc and you as a chiropractor, is to hope people don't have to go under the knife.
Right.
And avoid those very, very life-changing surgeries that
Yeah.
alter people's anatomy.
That's
And
exactly it.
you can't go back once you have surgery. So
Yeah, for sure.
what's been your experience doing chiropractic care on patients that have had surgeries like that?
Yeah, so we see a lot of different patients. I mean, we'll see a lot of patients that we see are athletes, especially runners and triathletes. We see trauma-related patients as well, from car accidents or whatnot. But majority of the patients we see are patients who just suffer from chronic pain. And they've been experiencing this for a very long time, and that could be from a culmination of just repetitive stress from poor posture, from previous trauma, just a bunch of different things, from being sedentary. And so a lot of these patients, they've tried everything. They're kind of on that point of, do I get surgery or not? And so they're at a loss. So a lot of these patients, they'll come to us, and we provide them a solution as best as we can. And what we want to do is not just get them out of pain, but we want to try to correct those underlying issues as much as we can. And although I feel like we do a lot, we can't do everything.
Yeah.
So that's where partnering with you and Dr. Wiederholtz comes in, as such a powerful partnership for us. Because with some of these patients that just need a little bit more, I think that's where the stem cells really come into play.
Absolutely.
And really benefit them. Yeah.
We treat a lot of things with stem cells. We can treat tears in tendons, joints, especially the cartilage in joints. I mean, that's
Yeah.
a huge one where
Yeah.
people have degeneration and arthritis.
Exactly.
And it's really amazing the studies that have shown the regrowth of some
Yeah.
cartilage and the changes in that joint space itself,
Exactly.
which limits the pain. The pain gets
Exactly.
better.
Yeah. So I mean, it's exciting because there's just a great solution for all these patients that don't have answers, and
Right.
this is such a great option for them. So yeah.
And for us, we don't do the cupping and the myofascial release, but we rely on you guys to do the manipulations and the chiropractic care and the decompression. And it's just a great synergy for both of
Yes,
us to get
sure.
patients what they need, getting patients taken care of, getting patients out of pain and on the road to recovery with relief. And with stem cells, it's a huge option for them, and it's there, it's available, it's in my office, and if they come see you, you're able to potentially refer them over for an evaluation and treatment.
Exactly. And that's where we provide like the pre and post injection rehab. And it is not like a magical cure, but I mean it's close to it. But we also really educate the patients on just making sure the wellness factor is there after the stem cell treatments, that we guide them through not just the wellness aspect, but with the nutrition and just keeping an active lifestyle as well.
Absolutely. Anti-inflammatory lifestyle
Right.
is a huge part of it, and I know you educate patient after patient after patient, as do I, and I
Yes.
try to do things the natural way, supplementation,
Yes.
dietary changes, and just even exercise
Right,
reduces
right.
inflammation, and just doing the basic things like that, but it requires a lot of education. And people are going to get that when they come see you.
Yeah.
They're going to get that when they come see me.
Right.
And they didn't teach us this stuff in med school,
Right,
and they didn't teach
exactly.
you this
Yeah.
stuff in chiropractic school. But we've learned along the way that
yeah.
this is how we really want to treat
Yeah.
patients, and we really want them to get better.
Yeah,
And
for
so
sure.
options
And
are great.
Yeah, and I think that's why you and I, our clinics are at the forefront, because we try to stay progressive with modern medicine, and this is just one of the ways. Yeah.
Absolutely. So let's reverse back a little bit. I mean, we all want the ultimate goal of
Right.
patients healing, patients getting better. So what started you on that path initially?
Yeah, so I've always been really active growing up, played a lot of sports, and been really obsessed with just health and fitness just in general. But I had my own fair share of injuries, and I got the pleasure to experience a lot of different routes in medicine, whether it be seeing an orthopedic surgeon, a chiropractor, physical therapist, and growing up in an Asian home, I also got to experience a lot of Eastern medicine as well,
Right.
Whether it be acupuncture or some herbal remedies. So I think there's a benefit to all of it, and just kind of going back when I opened up the practice, just helped me have a vision of how I wanted the practice to be. So I kind of brought it all in, and that's just kind of how I got started. Yeah.
That's fantastic.
Yeah.
Yeah, I love the holistic approach that you take, and we try to do the same thing.
Yeah, for sure.
It's just so important, and again, educating one patient at a time, and seeing what we have to offer them, because
Yes.
people don't have to live in chronic pain.
Correct,
You just
yes.
don't have to
Right.
to do that. And I've had my fair share of injuries too. I played Division I basketball in
Yeah.
college, and most recently I've torn my left Achilles twice.
Uh-oh.
I've just recently torn my right Achilles,
Yeah.
and I had PRP put in
Yeah,
them,
yep.
which is another great option to signal stem cells to
Exactly.
come and repair. Unfortunately, it's not instantaneous.
It's not. Yeah.
It takes a couple of weeks to heal, anywhere up to 3 months or so to get the full benefit, because it's a healing process.
Exactly.
When you tear a tendon, it has to build that bridge back
Yeah.
and repair that area.
Yeah.
And I think patients again need to be educated. Like, yes, this
Exactly.
might be a great option for you, but
Yeah.
I wish it would be an overnight instantaneous
Yeah.
fix, but it's not.
Yeah, and it's funny that you say that, because I've also experienced getting these injections as well, because I got one done about a month ago for my knee for torn articular cartilage, and it's good for providers like us to really experience what it's like on the other
Exactly.
end, right? So,
Exactly.
yeah.
Yeah, and I mean, one of the other regenerative treatments that we're providing in performance pain and sports medicine, and we've partnered with Dr. Choeng too, is called Disc Seal. A Disc Seal is a injection in the discs. It's almost like Fix-A-Flat for the discs if you have tears in the disc. And my partner, Dr. Wiederholtz, actually had it done a couple months ago.
Oh, nice.
And I'm planning on having it done in
Yeah.
January of
be right behind you.
2023 because I have 2 tears in my discs.
Yeah.
And I'm sick of the chronic, achy, nagging back pain.
Yes.
I have the option to get it treated. I'm
Right.
going to get it treated. I
Right,
have
right.
that available to me, and I'm really excited to share my results and continue, healing my partners, healing
Right,
you,
right.
healing myself, and especially healing my patients, because that's what I'm in the business to do.
Exactly. So I'm really excited about that one. I know that's a newer procedure, but another alternative than just getting a steroid injection, or even just getting some artificial disc or something like that. So
Right, yeah. We're here to really heal people and fix
Yeah.
the problem instead of being cut on with their architecture of their spine being changed or of their joints. I want to save the world from spine and,
Yeah.
and from spine and metal.
Yeah,
type
you
things
only
in
have
people.
one, so you got to take care of it.
That's what I always say.
Yeah, exactly.
If you're interested in any of these treatment options, please contact Dr. Billy Choeng here at Elite spine, or me, Dr. Suzanne Manzi at Performance Pain and Sports Medicine. We're happy to see you all for treatment options. Again, Dr. Billy Choeng's in West Chase and here in Spring, Texas, and I am in Houston, Texas, down in Greenway Plaza. We're happy to work together to get you better, because as you know from Pain Diaries, you have to take care of you so you can take care of business. Thank you, Dr. Choeng, for being here.
Thank you for having me. Thank you.
Absolutely. We'll be back with the commercial. See you soon. Welcome back to Pain Diaries. I'm here with Emily Trevino from Wise Insurance, and she's going to talk about all things related to health insurance today. We're so happy to have her here on Pain Diaries. And again, I'm Dr. Suzanne Manzi with Performance Pain and Sports Medicine here in Houston, Texas on NowMedia TV. Emily, welcome.
Thanks for having me. I am enjoying being on Pain Diaries, and one of the biggest pains right now is insurance.
I can't even tell you, in my practice, it's driving me crazy. It's driving my patients crazy, and I'm so glad you're here to present options for open enrollment season, as well as for people 65 and older and under 65.
Exactly. So at Wise Insurance, what we do is we offer options for people on Medicare that are turning 65. It's a jungle out there. There's a lot of information and a lot of misinformation. So we shop the plans for our clients. We go based on their needs, and we make sure that we find them a health plan that they can also see their providers and have access to their prescription coverage. For the under 65, we also do the same thing, and that is a jungle out there and a huge pain, especially when people are coming off their employer group plans or just moving to the area, and so they're looking for some options. So,
absolutely. Tell me a little bit about your office and where it's located.
So our office is here in Houston, Texas. We have, we're over off Bel Air and Wilcrest area, so Chinatown. We do help a lot of our Asian community as well as anyone else. We have a full staff there, so we have a sales team to help find plans for our individuals, and then we also have our care team, and they actually help our clients throughout the year. So a lot of times people will get an agent and they'll never hear from them again. They'll get into a plan and never hear from them again. So, which is terrible because
that's awful.
You have issues. Like I have a client right now who needed help finding a doctor, and I was helping her while we talked. Okay. So our care team is there for our clients all year round to help change doctors, look for doctors, help with prescription issues and access other benefits. And those are what's really important about working with an agent, is not just finding a health plan, but making sure you have access to those benefits.
Okay, great. And so if people, wanted to reach out to you, how would they do so?
You would give us a call at 832-308-0123, or you can go to our website, wisehealthins.com. There's a form on there. You can fill it out, and we will get to you as soon as possible. We were talking earlier that we are in our open enrollment season. So the Medicare open enrollment season started on October 15th and ends December 7th. So this is the time to shop your plan and make sure you get into whatever you're going to be in for the year by December 7th.
Yeah, this is crunch time.
It is crunch time. We are honing in, telling people you got to make a decision.
Get your holiday shopping done after December 7th.
Yeah, December 8th, you go
Get
do all that.
Get your health insurance now.
Exactly.
This is key.
That is key. And then the people who are under 65 that are offered an employer group plan, there are options for them, and they are affordable. That came through what we call Obamacare or the Affordable Care Act. So they have until December 15th to choose a plan to start January 1st. And then they'll have until January 15th is the absolute deadline to pick up a health insurance. So you just can't pick up health insurance whenever you want anymore.
Wow.
It is in enrollment season. So give us a call or go to our website.
So if I decide I want to change January 1st, what would I do?
So if you're under 65, you can give us a call. There are certain reasons why you can change throughout the year, either life-changing events and or it is based on income as well.
Okay.
So we can help them find a health plan based on that, on those circumstances. Same thing for Medicare. Medicare, they're allowed a one-time enrollment change from January 1st through March 31st.
Oh.
Or there's also special enrollment season, life-changing. But regardless of your situation, give us a call. We will help navigate this pain for you and make sure that we can solve whatever problems you're having and address any questions that you have.
Okay, cool. One more thing. Can you just explain the difference between an HMO and a PPO? Because I know that confuses everybody.
And that is a health insurance plan that affects people over 65 that are on Medicare and people under 65. So an HMO is a network-based plan, meaning you would stay in the network of doctors, specialists, and hospitals. If you go outside of that network, you don't have coverage.
Wait, so the insurance company tells me who I can see and who I can't see?
Yes, they do. So
wow.
You can always contact our office if you're our client, and we'll help find a plan for you, or a physician or a provider, hospital for you. But it is something that we look at when we find health plans for people, because we want to make sure that they have access to those providers. A PPO is where you have access to an in-network, just like an HMO would.
Okay.
And when you access in-network, you actually have lower copays and lower out-of-pocket costs. When you go to out-of-network, you'll have a higher out-of-pocket cost, but it allows you to have a flexibility to go see other physicians. So it really depends on networks, and that's something that we really hone in on to make sure that you have access to the providers you want to see.
Yeah, I know a lot of my patients, they're very particular about who they want to see and which doctors they want to keep. And I have a lot of patients saying, well, I couldn't do the HMO because I really wanted to keep my doctor of 25 years and they don't happen to participate in that plan.
Right.
So now I really understand now how this is all working for patients.
It is, and it is frustrating for patients because a lot of times HMOs tend to lean a little bit on the more affordability side. So what we try to do is we actually have developed very great relationships with our insurance companies, and we help add physicians, or at least approach the carrier to say, hey, can you add this doctor? Can you look at doing this? And they'll reach out based on their needs. So we try to maintain those relationships so that we can be kind of the voice for the consumers and the clients that are, hey, I want to go to this doctor. Or, for example, we're in the Vietnamese market and there's not a lot of Vietnamese providers in all these networks. So we're the ones really driving that connection between the carrier and the provider. And the carriers are very well receptive to it and are trying to address those needs, especially where there's language barriers.
Of course, that's so important. I mean, ultimately, as a doctor and as an insurance agent, I mean, we just want our patients to be cared for and to be taken care of so they can get the health care they need so they can get better.
Exactly, and there's a big focus on preventive health care. I know one of the biggest, mistakes made is like, oh, the insurance don't want to pay for anything, but they do. There's a big focus on preventive health care. You're starting to see a lot more, chiropractic, acupuncture. Some of those benefits are kind of being built in. I know Medicare clients have gym memberships built into their benefits.
That's amazing.
Medicare Advantage plans, and even some Medicare supplements. So there is a big focus on health. 15 years ago, it wasn't like that. You were only seeing sick patients. Now there's a big push on prevention. It's more affordable in the long run for both the client and the carrier.
No, that's great.
I hope nobody gets mad at me for saying that.
I'm sure they won't. Again, we're in the business to help people, and we really want people to get what they need the right way, and hopefully they can afford it too. And so that's great that you have options for patients. I try to present my patients with as many options as I possibly can when it comes to treatment. The insurance can cover this, this, and this, or some of the preventative things are covered, some of them are not, some of the regenerative things are not covered, and so these are our options.
And the great thing about regenerative medicine is that's becoming more and more common, and we do have products out there that can help match costs and things like that for clients that are paying cash for those things. So we do have other options that are not just a health insurance product, and that's probably something we can talk about as another pain. We're trying to make this pain-free for you guys.
Well, this is the Pain Diaries, so we have to get it all out there.
Exactly.
It's cathartic.
Yeah, it is.
So I'm hoping, if you all need health insurance and agents that care about you,
yes,
please reach out.
Yes, thank you.
No problem. Thanks for being on Pain Diaries.
We'll see you next time.
See you next time. We're going to go to a commercial break right now. I'm Dr. Suzanne Manzi with Performance Pain and Sports Medicine. See you back soon. Welcome back to NowMedia's TV show, Pain Diaries, broadcasting here in Houston, Texas on channel 2110. We're back with our recurring segment, Talking Insurance with April Clark. April, I'm pleased to introduce you and welcome back to the show.
Hi, I'm April Clark. Thank you for having me on Pain Diaries. I'm a health insurance agent. I'm licensed in about 35 states across the United States. Believe it or not, you need different licenses in each state because health insurance varies per state. So what I do is I typically specialize in helping individuals who are not offered health insurance through their job, or maybe it's just very expensive to add their family to their health insurance through work. I'm able to look into those other options. And today I'm going to answer the question to small business owners who maybe just have a handful of employees. They could just have maybe, even a family-owned business, or 5, 10, 15, 20, 30 employees. Okay. And they want to know, what are the benefits of offering health insurance? Okay. So that's what we're going to talk about today. One of the biggest benefits is recruiting. You're going to get a higher quality of applicants when you offer health insurance benefits. And obviously we all know hiring good staff is, the key to having a successful business, right? So when you are all able to advertise and let them know that we do provide health insurance benefits, that's going to be a huge benefit to them. And another is retention. Again, your benefits that you offer employees can make or break you. Many times your employees will get offers from other places, but if they're not being offered benefits and you're giving them benefits, that will be a factor in their decision. So when you're treating them well, you're taking care of them, they always stay longer statistically. Okay, and another tax benefits. There's tax benefits. So again, I'm not a CPA. You definitely need to talk to your CPA to find out your specific tax benefits. But in many cases, you can write off the portion that you're paying towards their health insurance. And as we all know, business owners need write-offs. So if you're looking at trying to save on taxes and improve your employee pool, health insurance benefits is a great way to do that. Another benefit, if you choose to work with me, is I can be your HR person, if you will. Okay. So rather than your employees coming to you asking health insurance questions, or you having to have a specific person in your business that is basically dealing with health insurance, I can do that for you. So I can save you the time, the trouble. And when your employees have questions, they call me directly about their health insurance rather than calling you or asking you. So that's definitely more convenient. I know how busy business owners are. So anything I can take off your plate. Another benefit that's been proven is you'll improve attendance. So employees that take care of their health, they're doing their preventative care. They're just trying to live a healthier lifestyle, always miss less work. So if you're trying to improve attendance, have more cohesion in the workplace, offering health insurance benefits is definitely a good way to start. And another big benefit is workman's comp claims. If you want to prevent workman's comp claims, which, by the way, you do want to prevent those. If you've not dealt with those, it can be a nightmare. If you're wanting to prevent workman's comp claims, there's actually health insurance policies that can help cover you on the job and off the job, so that if you do get hurt going into the workplace, or, something falls on you, you get injured at work, you can actually potentially file the claim through your health insurance rather than having to file through workman's comp. So it's another way to save and prevent, your rates from going up on your workman's comp insurance. So again, my name is April Clark. I'm so glad you had me on the show. Happy to answer any questions to those small business owners, entrepreneurs, self-employed people. My phone number is right on the screen. You can call or text me at 281-475-5047. Again, 281-475-5047, or you can see there my website's on the bottom. Or if you just Google April Clark Health Insurance Agent, you'll find me. Send me an email, give me a call. I'm happy to answer any questions you have about health insurance at no charge. Have a wonderful day, and thanks again.
Thank you so much, April. We appreciate all your information. Insurance is such a tricky subject, and we're grateful for you to shed light on this for us. I'm Dr. Suzanne Manzi with Pain Diaries on NowMedia TV. We'll be back with a commercial break. Welcome back again to Pain Diaries. I'm Dr. Suzanne Manzi at Performance Pain and Sports Medicine. We're now going to explore more insurance options, and I'm pleased to introduce Dana Oliva. NowMedia TV and Pain Diaries welcomes you back to the show.
Hello, this is Dana Oliva, the benefit strategist over at Alliance Insure Group, and this is Pain Diaries. In today's installment, we'll be talking about enrollment periods for the year 2023. Open enrollment starts on Tuesday, November 1st, 2022 for most states this year. Plans chosen from November 1st to December 15th, 2022 will have a start date of January 1st, 2023. Plans chosen between December 16th and January 15th, 2023 will have an effective date of February 1st, 2023. Some states like California will have their enrollment periods that will vary outside of the regular enrollment period. So check with your exchange or health advisor for more details. There are also special enrollment periods based on qualifying life events, like having a child, becoming a U.S. citizen, or moving will typically make you eligible for sign up for coverage outside of the normal enrollment period. There's also a new rule allowing individuals and their families that earn up to 150% of the poverty level to sign up year-round, so long as the ARP or the American Rescue Plan subsidy enhancements remain. This has been extended through 2025 with the Inflation Reduction Act. This is Dana Oliva. This has been the Pain Diaries, and I can be reached at 281-804-3494 and reached on the web at www.alliance, group.com.
Thank you, Mr. Oliva. We appreciate you and April being here with us today, as well as Emily, providing insight into the world of insurance. We look forward to seeing you all again on the show here in Houston, Texas at 2110 on NowMedia TV, Pain Diaries. I also want to introduce Marissa Burris. She's going to talk to us about a solution for more energy and feeling great. Here she is.
Thank you, Pain Diaries, for inviting me today. I'm Marissa Burris from the company My Vital C. For those of you who don't know who we are a company based in Houston, and we make supplements for health and beauty. And we use a molecule that we call ESS60. Today, we're going to talk about stress and some tips that could help you cope with stress. First, we have to understand what is stress and also the difference with anxiety. Well, I like saying about the stress is like a bear who is going to attack you and is coming after you, and those are the problems and every situation that makes you stressed out. And what do? You run, or you find tools to prevent this bear to attack you, or you attack back, right? And anxiety is when it's something that has not happened, and you see this bear standing up, watching you, and you're imagining that it's already chasing you, and you even feel that it's happening, and that's cause also pain and a lot of issues in your body. So, like we're saying, we're talking about stress, but also we have to understand that stress, maybe you can control and prevent it, and anxiety is similar, it's just that it has not happened. It's a situation that has not happened. So let's see why it's important to minimize the stress in our lives. Well, because it's like a circle. We get stressed, then we don't sleep. And if we don't sleep, then we don't have the energy to do anything, not even to start something. And therefore, we get stressed out, right? And a high level of stress could increase the risk of serious health problems that, you can have a problem with your heart or diabetes or other serious sickness. Basically, it can affect everything, every aspect of our lives. Physically, we get the body pain, or the serious problems in your health. Emotionally, affects our relationship with the people in our lives, people we work with the people we love, our family members. Mentally, because we don't perform the way we would like, and we cannot concentrate at work. But sometimes we don't know what we are under stress. So how do we recognize when we are under stress? When we get insomnia. We can't fall asleep, or we wake up every hour, or we wake up before the time we have to go to work, like an hour before, and then we are tired after that. We feel less energetic. We don't have the motivation, like I say, to do things. We feel that we need to drink more coffee or even alcohol. And sometimes we are drinking and we say, why? It's still early in the day. Why do we feel like we need to have a drink? And it's because we are under stress. And then we have body pain. Don't you feel like you have a neck pain? Even when you're in your computer and you're stressed out because you have to finish a work and it's almost the due day and you are not done, and you just feel it physically. And you are very upset with people too. Everything annoys us. We are under stress. We gain or we lose weight. So sometimes we blame because we don't have time to do exercise, or we are eating the wrong things like sugar and fat, or we just don't eat what we really need to eat. So it's important to recognize all these so we can control this stress. So what is out there for recommendations how to reduce stress? Sleep better. Establish a bedtime routine is important. Have a balanced diet. Take your supplements. Enjoy outdoor activities. I have a friend, she said she works the whole week, and then at the end of the week, she goes to a lake or go on a boat ride or something outdoor, and that's relax her. So whatever works for you, make a hobby, do something. I like painting, I like dancing, I like singing, but I cannot sing very well. And if you can play an instrument, music is always good for stress. Finally, work out, very important. It's a topic that we had to talk in other segments, because working out, number one, like I said, when this bear is chasing you, you have to put that adrenaline out there. You run, but you're not gonna wait until the bear is attacking you. You do it every day. So tell me, what do you do to reduce your level of stress? Put it in the comments. If you're not sure if stress is what caused all this pain, and you're taking all these steps, even probably seeing a therapist, and you have these symptoms, please visit a doctor. My Vital C products have shown in hundreds of testimonials that help you sleeping. We have a number one testimonial as that people can fall asleep faster, they don't move around, and they don't wake up all the time because they feel they sleep deeper. But it's different for every person. But if you sleep better, then you have more energy the next day, during the day, and better concentration at work. And if you have energy, you probably are gonna do more physical activities and do all that I say, going out, walk, doing all these activities, like I said, dancing, but you have to sleep better. So we have many testimonials. You can find us in our website, www.vitaless60.com, or follow us on Instagram at vitaless60, and send me your comments. Any questions, you can also send me an email at marisa@myvitalc.com. I remind you that I am not a doctor. These statements have not been evaluated by the FDA, and these products are not developed to treat, cure, or prevent any disease. I hope you have a healthy and productive day and night. Thank you.
Thanks for joining me today, Marissa. We're so grateful to have natural alternatives for our health and wellness. Thank you for elaborating on My Vital C, and we look forward to seeing you again on future episodes. Thanks again. Remember, I'm Dr. Suzanne Manzi, and this is Pain Diaries. Take care of you so you can take care of business. We'll see you next time.
This has been a NowMedia television feature presentation. All rights reserved.